Ladies and gentlemen, Convocation is now in session. As Western University's acting Chancellor, I am pleased to welcome everyone to the 303rd Convocation. To all our graduates, let me first say congratulations. You have worked very hard to be here, and your presence is well-deserved. Today marks a major turning point in your life, and we celebrate that milestone by gathering together as the Western University community to let you know that we support you now and in the future. However, your learning days are far from over. Learning is a lifelong process, and Western has not provided you with the answers to all questions. At most, we hope what stays with you is a way of thinking, objectively, approaching problems with an open mind and a healthy respect for new ideas, all tempered with compassion and with empathy for the human condition. You are forever a cherished member of this great university, founded more than a century ago. We welcome you into the Western family. Again, congratulations to each and every one of you. The MD ceremony marks a particularly important day for Western and the Schulich School of Medicine and Dentistry, as it reminds us of our partnership with the University of Windsor in providing a two-campus Doctor of Medicine program. To recognize this, I invite Dr. Alan Wildeman, the President of the University of Windsor, to bring greetings from his esteemed university.
Distinguished guests, doctors, I'm very pleased to be able to be here to say a few words. The University of Windsor is very proud to be partnered with Western to host the Schulich School of Medicine and Dentistry on our campus. And to all of the graduating class today who was a part of the program in Windsor, you now have loyalties to two institutions going forward, but certainly your time at Windsor has been very important to us, and I hope that you have enjoyed it there. But do not forget Western and the proud opportunity you have to have a degree from them. To all of the friends and family from Windsor who have come, I thank you very much for being so supportive of what we're doing in Windsor. This truly is a wonderful partnership that we have got. To all of the people graduating today, you certainly are joining a profession that has centuries of history of improving the quality of life. And it's not only about the science of life, it's the humanity of life, and you will be engaged in that, and everyone is going to look to you for leadership and wisdom and expertise and all those other amazing things. And I want to wish you all absolutely the very, very best. And I know that there's a lot of people here to celebrate with you, parents, friends, and families, and faculty and staff who worked very hard with you throughout all of your years in school. And the best is yet to come, I assure you. And I want to wish you all the very, very, very best. Thank you.
Thank you, Dr. Wildeman. The strong relationship that has been built between the University of Windsor and Western University is really the proof of what positive outcomes can come from such collaborations. Thank you again. Today we also have the honor to confer an honorary degree upon Jacob Van Dyke in recognition of his outstanding contributions as a scientist, a teacher, consultant, and administrator. I am delighted to welcome him to Convocation, and to present our distinguished candidate, I'll now call on Dr. Michael Strong, the Dean of the Schulich School of Medicine and Dentistry.
Jacob Van Dyke has devoted his professional career to advancing the field of medical physics, specifically the safe and effective use of therapeutic radiation for the treatment of cancer. In doing so, he has touched the lives of millions of people in Canada and literally around the world. Following receipt of his Master's of Science degree in Physics from Western University in 1971, Dr. Van Dyke was appointed medical physicist at the Princess Margaret Hospital and lecturer in the Department of Medical Biophysics at the University of Toronto, subsequently rising to the position of Associate Professor. It was during this time that he performed research that significantly advanced our knowledge of radiation biology to the lung and to the injured lung from radiation therapy. With the advent of CT scanners in the 1970s, he seized the opportunity and combined CT-based lung density studies with calculations to determine the dose response for the human lung. The resultant lung tolerance curves for the radiation has been cited as a standard reference for decades. Working closely with Dr. Richard Hill, he further demonstrated unexpected effects of radiation that occurred well outside of the treatment field. Today, such bystander effects, as you've all been taught, are actively researched. In 1995, he returned to London as the head of physics and an engineering group at the London Regional Cancer Centre and as an associate professor in the Department of Oncology. Within a few years, he received his full professor status. His recommendations, embodied in quality assurance standards, now are used throughout the world. He has led the development of international standards as well for quality assurance of computerized treatment planning systems, a critical component of today's modern radiation therapy. He is recognized as a Fellow of the Canadian College of Physicians in Medicine, the American Association of Physicists in Medicine, the Institute of Physics in the United Kingdom. In 2011, he was awarded the Canadian Organization of Medical Physicists' highest award, the Gold Medal. In 2011, he retired and assumed the position of Professor Emeritus. Today, he continues to work in radiation medicine through his role with the International Atomic Energy Agency, assisting developing countries. He also continues to contribute to the academic life at Schulich through the Departments of Oncology and Medical Biophysics. Madam Chancellor, on behalf of the Vice Chancellor, in the name of the Senate, I ask you to confer the degree of Doctor of Science, honoris causa, upon Jacob Van Dyke.
By virtue of the authority vested in me as Acting Chancellor, I admit you to the degree Doctor of Science, honoris causa. Welcome to Western. On behalf of all of us gathered today, I'd like to welcome our newest alumnus to address Convocation.
Chancellor Deakin, President Wildeman, Dean Strong, esteemed platform party, proud parents, supportive family, dedicated friends, and fellow graduates. So here you are, a group of very talented graduates who have achieved one of your lifetime goals. I would like to personally congratulate each and every one of you on this very significant occasion. This day is really a celebration of each and every one of you on your success. While I'm a medical physicist and not a medical doctor, I've had the privilege of serving on the selection committee for new residents in radiation oncology. This is the through the Canadian Resident Matching Service, the well-known CARMS process. I can see the smiles on your faces when I say that. So I have managed to see a lot of CVs, and I've managed to interview a lot of medical graduates. So I've been able to develop a general profile of what a medical graduate looks like. In addition to your MD, some of you have master's degrees. Some of you have PhDs. Some of you have multiple peer-reviewed publications. Some of you have traveled the world extensively. Some of you have helped in the developing world. Some of you are musicians, virtually at the professional level, but you've given that up to study medicine. Some of you speak multiple languages. The key phrase here is that you're all very high achievers. What I couldn't figure out is how you could do all these things and get a degree in medicine and be as successful as you are. So in looking back over the last 45 years, since I started my graduate studies in medical physics, it's fair to say that the world has changed dramatically. When I was your age, I didn't have the internet in my pants. We didn't even have the internet not in our pants. That's a quote from Twitter CEO Dick Costello, but it applies to me even more than it does to him because I'm older than he is. In radiation therapy, for example, the use of computers grew exponentially. I started in a time that is now known as the two-dimensional radiation therapy era, a time in which tumors and normal tissues were localized with regular conventional radiographs. And then in the 1970s, with CT scanning becoming available, we moved into the three-dimensional conformal radiation therapy era. And then in the 1990s, it became intensity-modulated radiation therapy. In the 2000s, the buzzword became image-guided radiation therapy. And now, we're in the four-dimensional era. We take into account the fact that patients are breathing and tumors are moving while the radiation beam is on, and it's accounted for in real time. So why all the details of this one specialty area of medicine? I have two reasons for doing this. The first is that the evolution that has taken place in radiation therapy runs parallel to the evolution in medicine in general. The rate of change in medicine is increasing exponentially. As a result, analogous changes that we have seen in radiation oncology also occurred in the other subspecialties of medicine. And the evolution of changes taking place in the future is going to be that much more rapid. The other aspect is that when we think of radiation therapy globally, we find countries in the world that have no radiation therapy at all, some countries that live in the two-dimensional era of our 1960s and 70s, some that live in the three-dimensional era, some that live in the modern era. So clearly, these types of issues exist across the board in other subspecialties of medicine as well. So these two issues, that is the rate of change of medicine and the global challenges, add new responsibilities to the collective of medical doctors and affiliated professionals. Together, we have a social responsibility to the healthcare inequities that exist around the world. For example, you may have heard that cancer kills as many people as HIV, AIDS, malaria, and tuberculosis combined, and that the increase in the incidence of cancer is growing much more rapidly in the developing world than it is in the developed world. So what does this have to do with you? Well, you all have hopes and aspirations for your future. You have a plan, although it's not clear how that plan will actually evolve. And I can speak from experience in this context. As you heard earlier, I finished my graduate degree in radiation physics here at Western in 1971. My wife Christine and I decided to do a grand European tour after I finished my studies and before I started my career at the Princess Margaret Hospital in Toronto. And we had 3 weeks to do this, and we decided we would see as many countries as possible since we thought we might never get back to Europe again. Little realizing that 3 years later we would live in Geneva, Switzerland for a year, and that one of our children would be born there. Furthermore, the opportunity to lecture in multiple countries and to speak at this convocation was well beyond any of my wildest expectations. So in this context, I do want to express my deep appreciation to those who were behind this nomination and the support of the Senate Selection Committee. This is certainly an esteemed honor, well beyond the realm of anything that I had expected. But the reality is there's a long list of colleagues who need to be credited for this honor as well. It is my colleagues, both from the Princess Margaret Hospital in Toronto and from the London Regional Cancer Program, who need to be recognized for their influence over my career. Much of the research and teaching was a collaborative effort and teamwork with my colleagues at these organizations. If it was not for them, I would not be here today. And then there's one other very significant person who needs to be acknowledged, and that person is my wife, Christine. She's the behind-the-scenes person who had provided constant support and encouragement that provided a great home context for career development. And of course, my children and grandchildren who continuously show their love and support. Medicine is a very quantitative profession. Einstein, as a physicist, is very quantitative in his analysis. However, listen to what Einstein says, and I quote, "Not everything that can be counted counts, and not everything that counts can be counted." This is very relevant in the context of our own lives. We can easily count the money we earn, the number of procedures performed, the number of patients seen, the number of lectures given, or the number of papers published. But is that all that counts? Not everything that can be counted counts, and not everything counts that can be counted. So what are some of the things that can't be counted? Here are three thoughts. There's many things that one can think of, but here are three thoughts based on my 40-plus years of working in a hospital context. The first thought is, remember your priorities. You may have heard the story about the professor who gives an interactive demonstration, brings out a glass jar, and carefully fills it with fist-sized rocks. After some discussion as to whether the jar was full or not, she added gravel, and then she added some sand, and then some water. So the point is not that no matter how full your schedule, you can always fit something else in. The point of the demonstration is that you have to put the big rocks in first, otherwise you won't get them in at all. So what are the big rocks in your life? Time with your loved ones, your family, your faith, your friends, mentoring others, a worthy cause. Whatever your priorities, remember to put these big rocks in first, or you won't get them in at all. The second thought, invest in the success of others. Interestingly, this has a way of enhancing the likelihood of your own success. Somehow the I come first attitude seems to have a way of backfiring. Some of the most successful leaders and researchers have been productive because of the interaction and support of their colleagues. I have seen this in the colleagues with whom I've worked, and I can definitely attest to that in my own career. I'm standing at this podium because of the skills, the support, and the teamwork of individuals with whom I have worked. The third thought, celebrate the moments. Our lives are filled with imperfections that confront us on a daily basis. Some of these will lead to significant frustrations. Unfortunately, our lives are very busy, and as people of action, we tend to address the issues or the problems as they occur. At the same time, our lives are filled with victories, usually small victories, and sometimes large victories. We should take the time to celebrate even the small victories. This could begin with a simple thank you, or it could go as far as an occasional social event. Celebrations of the moments can have a major influence on counteracting the daily imperfections that confront our lives. So here we have it. These three life's activities can be summarized in 3 words: priorities, invest, and celebrate. The acronym happens to be PIC, Priorities, Invest, Celebrate. And yes, it's an abbreviated version of PIC, the PIC line. You know what that stands for, but for parents and friends, the acronym PICC stands for Peripherally Inserted Central Catheter. These PIC lines help carry life-saving nutrients and medicines into the body. Similarly, keeping your priorities straight, investing in others, and celebrating the moments are a way of maintaining a solid equilibrium in your practice and in your life. So in summary, being here today means that you've now achieved one of your life's goals. I hope that you've enjoyed the journey, and as you move forward, I hope that you will remember the priorities in your life, that you will invest in others, and that you will celebrate the moments. Note that not everything that can be counted counts, and not everything that counts can be counted. So I wish you success as you embark on the next phase of your journey. May it also be fruitful and successful. Once again, congratulations, and celebrate the day. Thank you.
Dr. Van Dyke, on behalf of Convocation, I would like to thank you for your address. I don't think I'm ever going to look at a PIC line the same way again. We are honored to welcome you to the Western University and to recognize your achievements with this honorary degree. Ladies and gentlemen, please join me in congratulating our Honorary Doctor of Science, Dr. Jacob Van Dyke.
At this time, I take great pleasure in asking the Dean to present an esteemed colleague for the Distinguished University Professor Award.
The Distinguished University Professor Award is Western's highest recognition for a faculty member. This award is presented in honor of sustained excellence in teaching, research, and service accomplished during an outstanding scholarly career at Western University. Will Professor Michael Reeder please step forward? Dr. Michael Reeder is recognized for sustained excellence in scholarship, where he continues to make outstanding contributions to research, education, and service. He is an award-winning and internationally recognized clinician, scientist, focused on the pathogenesis of serious immune-mediated disorders, particularly in the realm of adverse drug effects. As an education innovator, he has helped to develop an integrated third-year clerkship curriculum and brought the Clinical Investigators Program to Schulich Medicine and Dentistry. His dedication to education has been recognized through many awards and accolades, including the Schulich Undergraduate Leader Award for Excellence and the Class of 1962 Award, for which he was presented on 4 occasions. His commitment to service and the community is extensive, as he serves on numerous committees at the university and nationally. Locally, he has given back to the community, fostering more than 150 medically fragile infants during the past 13 years. And writing a book for foster families called A Star for Ray. Madam Chancellor, it is my pleasure to present to you Dr. Michael Reeder, recipient of the Distinguished University Professor designation.
Congratulations. At this time, it remains my pleasure to ask the Dean to please present another esteemed colleague for our university's top research award, the Helmuth Award in Research.
The Helmuth Prize for Achievement in Research was established so that members of the Western community can appreciate and celebrate the research achievement of our most distinguished faculty members. The 214 recipients of the Helmuth Prize for Achievement in Research are outstanding examples of Western's rich research tradition. I would ask Dr. Stuart Harris to please step forward. A professor in the Department of Family Medicine with a cross-appointment to the Department of Epidemiology and Biostatistics, Dr. Stuart Harris is the Ian McWhinney Chair in Family Medicine and a scientist at the Lawson Health Research Institute. He has achieved international renown for his research on type 2 diabetes mellitus in high-risk populations, including Aboriginal Canadians and new immigrants, as well as for his translational research on improving the management of diabetes in primary care settings. Throughout his career, Dr. Harris has received extensive research support from industry, national foundations, and publicly funded organizations. He has authored more than 200 articles in peer-reviewed journals and continues his clinical practice at the same time. Through his broad-based and innovative research, Dr. Harris is contributing to improved health care for First Nations and for all Canadians, and is informing government policies and strategies for diabetes prevention and care. Madam Chancellor, ladies and gentlemen, please join me in congratulating Helmuth Prize recipient, Dr. Stuart Harris.
Congratulations, Professor Harris. I would now ask the Dean to please present another esteemed colleague to receive the Edward G. Plevna Award for Excellence in Teaching.
The Edward G. Pleva Award for Excellence in Teaching was established in 1987. Each year, the Pleva Award recognizes 4 full-time faculty members whose outstanding contributions to teaching have earned them numerous awards and wide renown. Will Professor Jerry Batista please step forward? During his decades of experience, Dr. Jerry Batista has proven his commitment to education. His personal teaching philosophy emphasizes making his lectures impactful to the students' lives. He starts from a comfort zone, using everyday analogies before delving into more challenging course material. He is praised by students for his good sense of humor, his responsive demeanor, and his ability to deliver a lecture that leaves the audience captivated. I should add, you should listen to his band. His contributions go beyond the classroom. One of his most significant contributions to education is the development of DeskCat, a device that brings the concepts of medical CT scanners to the classroom. These devices have been hailed as highly beneficial to students and are now used in more than 25 universities worldwide. Dr. Batista also successfully completed an in-class course into an online web-based course, one which colleagues hail as superb. He was instrumental in the external accreditation of medical biophysics education at Western, creating the CAMPET program, with a program specifically designed to give PhD students clinical skills they need in their careers beyond technical knowledge and research alone. The program is flourishing with a number of graduate students currently enrolled across this special program. Dr. Batista's dedication to teaching at the Schulich School of Medicine and Dentistry demonstrates just how much one person can enrich the lives of so many. Madam Chancellor, I present to you Dr. Batista.
Thank you. The designation of Professor Emeritus is an honorary title which recognizes long and distinguished academic service. I would now like to call on Dr. Bertha Garcia to present Convocation with our 5 newly appointed Emeritus Professors.
Will Professor Michael R. Curran please step forward? Dr. Curran graduated as a physician at the University of Witwatersrand in Johannesburg. Thereafter, he specialized in anesthesia and attained a fellowship in anesthesia from the College of Medicine of South Africa. Dr. Curran also completed his master's degree in clinical pharmacology at the University of Pretoria and the Advanced Executive Program of the School of Business Leadership of the University of South Africa. In 1991, Dr. Curran came to Canada, working as an anesthesiologist in Grand Falls, Windsor, Newfoundland. In 1997, he began his career at Western as a resident in anesthesiology, and following a fellowship in obstetrical anesthesia at St. Joseph's Healthcare, Dr. Curran was hired as assistant professor and promoted to associate professor in 2009. Dr. Curring has been active and valued member of the Department of Anesthesia and Perioperative Medicine, providing teaching excellence in our hospitals and administrative leadership as a charter member of our anesthesia academic plan. Madam Chancellor, it is my pleasure to present Professor Emeritus Michael R. Curring.
Congratulations, Dr. Curring.
Will Professor Peter R. Flanagan please step forward? Peter Flanagan obtained a biochemistry degree from University College in Dublin, Ireland, and a PhD from the University of British Columbia. He started at Western in the early days of University Hospital with Dr. Leslie Wahlberg, a pioneer of biomedical research in iron metabolism and hemochromatosis. Dr. Flanagan had many important publications on iron overload and later collaborated with Dr. Paul Adams on iron overload research in the Department of Medicine. Dr. Flanagan changed gears later in his career and devoted his efforts to undergraduate medical education. He was particularly interested in e-learning, and he became a great advisor and mentor to generations of medical students. Curriculum reform and education research became his new focus, and he quickly became one of the most popular teachers in the medical school. For his many achievements in undergraduate education, he was awarded a Schulich Educator Award. For his endless devotion to his students, he will always be fondly remembered. Madam Chancellor, it is my pleasure to present Professor Emeritus Peter R. Flanagan.
Congratulations, Peter. Thank you very much. Thank you for
Will Professor Carol P. Herbert please step forward? Dr. Carol Herbert has had a distinguished academic career in clinical family medicine, research, and education. She is Professor of Family Medicine at Western University in London, Canada, cross-appointed to the Department of Pathology, and an affiliate member of the Department of Women's Studies and Feminist Research. Dr. Herbert is a UBC graduate in honors biochemistry and in medicine, and she was professor and head of the UBC Department of Family Practice from 1988 to 1998. She served as Dean, Schulich School of Medicine and Dentistry at the University of Western Ontario from 1999 to 2010, one of the first female and family physician deans in Canada. Under the decanal direction of Dr. Herbert, Schulich grew in size and reputation as a socially responsible medical school, which provides exceptional student experience in a research-intensive environment, including community-based experience for all of our MD graduates. She spearheaded the development of the Southwestern Ontario Medical Education Network, which includes a regional campus in Windsor, as well as partner communities across Southwestern Ontario. She is a recognized leader in interprofessional education and collaborative practice, women's health, and mentorship of academic women. She has chaired or served on multiple task forces on health policy and health professional education. She is internationally known for her leadership in primary care research and for her work in clinical health promotion, patient-physician decision-making, and participatory action research with Aboriginal communities. She has been honored with many awards, including the Partners in Research Biomedical Research Ambassador Award in 2010, the Selim Award for Excellence as a Role Model, Advocate, and Mentor for Women in Medicine and Dentistry in 2009, the Maurice Wood Award for Lifetime Achievement in Family Medicine Research in 2007 from the North American Primary Care Research Group, and the Dr. Ian McWhinney Award for Family Medicine Education in 2007 from the Department of Family Medicine at Western, as well as many other distinguished awards. Madam Chancellor, it is my pleasure to present Professor Emeritus Carol Herbert.
Thank you so much.
Will Professor Trevor Lobb please step forward? Dr. Trevor Lobb graduated in medicine from Western University in 1969. He then undertook residency training in anesthesiology, obtaining his FRCPC in 1974. The same year, he joined the Department of Anesthesia as a consultant anesthetist, a position he continues to hold. Since 2002, he has held the position of Associate Professor in the Department of Anesthesia and Perioperative Medicine, Schulich School of Medicine and Dentistry. In his early career, he was involved both clinically and academically in intensive care medicine, and laterly has developed a particular interest in pediatric anesthesia. He has published numerous papers on the interconnection on ventilation and the use of the vein breathing circuit. Throughout his career, he has been actively involved in both medical student and resident education and has been actively supportive of research activity. He's a talented clinician anesthetist and the very epitome of what a consultant physician should be. Madam Chancellor, it is my pleasure to present Professor Emeritus Trevor R. Lobb. Will Professor Carol Tim please step forward? Dr. Carol Tim graduated with first-class honors in electrical engineering at the University of Waterloo in 1975. He pursued graduate work in the field of microcirculation, the study of blood flow in the smallest blood vessels, at Western. He earned his PhD in biophysics in 1980, and he then completed postdoctoral training at the Max Planck Institute in Germany. Dr. Tim returned to Western as a faculty member in medical biophysics, becoming a full professor in 1995. He is a research scientist at the Lawson Health Research Institute. Dr. Tim pioneered live microscopy of microcirculation in Canada. He has contributed significantly to our fundamental physiological understanding of the function of the blood vessel wall, as well as to our clinical understanding of why organs fail during sepsis. Dr. Timmel's work has been recognized at the international level and had over 200 publications. He has won major national salary awards, and his graduate students have won major national and international awards. Madam Chancellor, it is my pleasure to present Professor Emeritus Carol Tim.
Madam Chancellor, Dean Strong, honored faculty, Class of Medicine 2014, families and friends, good morning, and welcome to the 2014 Doctor of Medicine Convocation ceremony. My name is Robert Hammond, and I've got the pleasure and privilege to be your Master of Ceremonies this morning. And what a great day for our graduates and for their family and friends who've supported them on this trip. Your job, though, today, after all of that hard work, is just to sit back and relax, soak it up. There's some wonderful lifelong memories coming your way. In the interest of everyone's relaxation and enjoyment, I would ask that everyone please take a moment at this time, if you haven't already, to turn off or mute all cell phones and pagers. Please, thank you. Well, dear Meds 2014, congratulations again. You made it. Allow me to begin by inviting Dr. Michael Strong, Dean of the Schulich School of Medicine and Dentistry, to deliver his message to the class of 2014. Dean Strong.
Madam Chancellor, honored guests, colleagues, family and friends, and most importantly, graduates. This is indeed one of the great occasions in the life of our school. On behalf of all of my colleagues, let me be amongst the first to extend to you our heartfelt congratulations as you celebrate this achievement. It truly is momentous. I think we can all agree today is a pretty big deal. In just a few minutes, you're going to be conferred the degree of Doctor of Medicine. This is a day that some of you have waited for years, for some of you, perhaps all of your life. For your parents, it may well be the end of a very long but fascinating journey that at times was without an end in sight. But I can assure you that as a parent myself, that their journey with you was worth every step. For me, this is also a very special day. You were the first class that I welcomed as a new dean at the white coat ceremony. So how many of you remember what I said that day? Bet you didn't think there'd be a test, did you? Fear not, although I really do suspect very few of you can do that, which really surprises me. As a neuroscientist, I know that fear and excitement are the two most fertile grounds upon which to impart new memories. It's that you became a physician at the very moment that you put on the white coat. And that with that seemingly miraculous transition, you also acquired a personal and a societal responsibility. 4 years later, absolutely nothing has changed, except you. I have no doubt that you have grown, just as I have no doubt that I too have grown in my role. We both came into new periods in our lives with a bit of fear, a lot of excitement, and a tremendous learning curve ahead of us. It really has been a very interesting journey, and I trust it's been the same for you. In this journey, you've had to learn an immense amount of fact, ranging from seemingly the smallest detail of how a cell functions, to how individual cells coalesce to form something loosely recognized as a human, and then how the same exquisite symphony of function can become a train wreck of immeasurable proportion. We taught you how to examine patients and how to extract the smallest of details of an illness. We've shown you how to take all of this knowledge and with rapier-like accuracy formulate, okay, well maybe not rapier-like. Okay. But if all that was all that we achieved, then I fear that we've done you a disservice. Voltaire once wrote, "Doctors are men who prescribe medicines of which they know little, to cure diseases of which they know less, in human beings of which they know nothing." This was hundreds of years ago, and yet I worry that we are turning you out into a world where the words of Voltaire still resonate. A few weeks ago, when I was struggling with how to convey this concern to you in a manner that even remotely makes any sense, I was at the home of a friend who also happens to be a dean of a medical school. As the night moved along, the conversation, I do have friends, okay? And they're not all deans. As the night moved forward, the conversation turned into a debate about the social covenant that we have for the training of physicians and surgeons. The basic tenet was this: we live in a society at a time when everything is viewed as a commodity, when the simple act of seeing a patient is something that's enumerated, reimbursed, tracked, and then looked at as an outcome. We are asked to look at cost efficiencies as if an individual human is simply another item to be judged in real time. We are asked to make decisions that require a tremendous amount of information, assimilate this into a single outcome, and then institute evidence-based treatment plans that will deliver a well-circumscribed outcome, generally the better health of the patient. I can look at a demographic curve, see the aging of the population, plot each of you as an entity, predict how many of you will work for how long, and in what capacity, and I can call that a physician supply and demand curve. And we, society, can rest comfortably that we've done the right thing. You and I are commodities. So right about now, you're probably thinking, yep, last person I want to invite over to dinner. But there's a flip side to this argument, and it is why when I look at the generations of physicians that we are graduating, of which you are shining examples, that I so firmly believe that all will be well. And it's because of the tremendous sense of societal responsibility that each of you emulates. You must always remember that the word patient is an English derivation of the Latin patiens, which means I am suffering. We need to not just hear our patients, we have to listen so carefully. It is the essence of what we as physicians must do, and it is what you must now move on to perfect for the rest of your lives. As the next generation of physicians practicing in an increasingly complex environment, it is for you to prove every day that you are not technocrats. You were not trained to simply see an individual, come to a conclusion, and then fire them out the door. You and I, we need to continue to grow and to learn that every individual in front of us is truly an individual. There are aspects of their lives that we'll never touch, and nor should we. But we need to understand that there will always exist a layer that changes everything. It is that added dimension that cannot be found in any scientific writing. The American actor Alan Alda once said, "Listening is being able to be changed by the other person." You need to be open to that change, for over the rest of your career, your teachers are now going to be your patients, their families, and their loved ones. It is they who will mold you and shape you into compassionate physicians. People ask, why as a dean do I still make time to see patients? It's precisely because they are patients. They are suffering, and in their suffering, they teach us every day to be better than we are. They teach us to stop, to listen, to care. We can teach you about that, but only you can truly learn from them. It is the essence of this journey of the rest of your life. I will leave you with one last quote, a favorite of mine from Norman Cousins, who was many believed to be the father of modern laughter therapy. He was once quoted as saying, "If something comes to life in others because of you, then you have made an approach to immortality." All of us on this stage wish you immortality. In return, we ask only one thing of you, and that is that as you begin this next phase of your life, that you never stop seeking it. That you grow with your patients, and that every time you interact with another human being, that you cherish that that is exactly what they are, another human being. Can you imagine our world if everyone realized that our social and societal responsibility to each other was exactly that gift that they have given you? Use it well. Thank you.
Thank you very much, Dr. Strong. Dr. Andrew House and Dr. Faisal Rahman, wonderful people, brilliant clinicians, and they're also the honorary class presidents for the class of medicine 2014. Dr. House and Dr. Rahman will now address the class. Andrew and Faisal, please.
Thank you, Dr. Hammond. Madam Chancellor, Dean Strong, honored guests and dignitaries.
Well, Andrew, it's that time again when we must recognize the accomplishments of our students as they are finally awarded their MD degree.
It really is wonderful, Faisal. I look out over this sea of fresh-faced graduates and their proud parents and grandparents and family members, all of whom sadly are thinking they're going to get free and useful medical advice.
Little do they know how truly useless they really are. I would rather get my advice from Dr. Oz.
Family members, please, whatever you do, wait at least 2 or 3 years into residency before taking their advice.
Anyways, here we are, standing before you, expecting to give these students useful advice on how to be great physicians, great team players in a very difficult medical environment.
I just can't bear to give another boring speech, Faisal. I have an idea, though. It just came to me as we were sitting here. With the indulgence of Madam Chancellor, I would suggest that we do a musical tribute to tell them how we really feel about them.
I like that idea. But first we must get ready.
Thank you.
Maestro, cue the music. Look at this face. I know the years are showing. Look at this life. I still don't know where it's going. I don't know much, but I know I love you. And that may be all I need to know.
man's eyes, but never seen what mattered. Look at these dreams, so beaten and so battered. I don't know much, but I know I love you. And that may be all I need to know.
So many questions still left unanswered. So much I've never broken through.
Oh, and when I feel you near me, sometimes I see so clearly the only truth I ever know is me and
you. Look at this man, so blessed with inspiration. Look at this soul, still searching for salvation. I don't know much, but I know I love you. And that may be all I need to know.
Put your hands together, class 2014. We don't know much, but we know we love you.
I don't know much, but I know I love you. And that may be all I need to know. I don't know much, but I know I love you. That may be all there is to know.
Thank you. Thank you, Madam Chancellor, for your indulgence.
Well, if that isn't the proverbial tough act to follow. Just to let you, we love you too, guys. Well, thank you, Drs. House and Raymond. It's now my pleasure to invite Caitlin Carew, Rahul Sharma, and Kenneth Lamb to come forward and present the class composite photographs. Caitlin will make her presentation to Dean Strong. Rahul will present to the school with Dr. Gary Tithicott accepting, and Kenneth will make his presentations to the honorary class presidents, Drs. Andrew House and Faisal Raymond.
We were told we didn't have to say anything. Lovely song.
That's great.
Thank you very much, Caitlin, Rahul, and Kenneth. Now, please welcome now Dale Edwards as he comes forward to announce the recipient of the Class of '62 award. Dale.
The Class of 62 Award is presented annually to the faculty member who, in the opinion of the class, has contributed the most to the medical school in the previous 4 years. This year, the award is going posthumously to Dr. Francis Chan. Dr. Chan was a professor of anatomy, previously the Associate Dean of Admission and Student Affairs, and was the Assistant Dean of Student Affairs when we entered medical school. In this role, he welcomed us to Western. He made every effort to make us feel at home, from his warm welcome at the white coat ceremony, where he reassured us that being in medical school was real and not a dream, to meeting with each of us individually during our first weeks of medical school, to inviting us to drop by his office anytime to visit with him and his dog Jet. He was a gifted anatomy teacher, both in the classroom and in the lab, and he taught us the importance of being caring and compassionate physicians. He was a true role model for maintaining balance between a demanding career and a personal life. He traveled extensively, he appreciated the arts, he shared his experiences with us, encouraging us to explore our own passions outside of medicine. His concern for the well-being of the students was genuine and truly appreciated, as his numerous previous Class of 62 awards can attest to. Sadly, last year he died on June 13th after a battle with cancer. His passing was a tragedy for his community, for his family, for all of us at Schulich. At his memorial service, he had left us with a quotation from Ernest Hemingway. "It is good to have an end to journey toward, but it is the journey that matters in the end." He was a man who lived life fully, and as we journeyed towards becoming physicians here in medical school, he instilled this zeal for life in every single one of us. It is an honor to invite Dr. Marjorie Johnson up to accept the Class of 62 Award on behalf of Dr. Francis Chan.
Normally the recipient doesn't get to say anything, but I wanted to tell you that Dr. Chan's family sends regrets. They are at this moment in Hawaii with Dr. Chan's ashes, spreading them on his final resting place. This is a journey he sent them on, and they've lived up to his word. So as in death as in life, Francis continues to send all of us on our journeys. And as you may know, Francis coordinated this convocation ceremony for many, many years. And Andrew and Faisal, I think he would have approved. In fact, I think he would have been up there dancing with you.
Thanks, Dr. Johnson. And thank you, Dale and Class of 2014, for your recognition of our dear and departed colleague, Dr. Francis Chan. Truly a wonderful and inspiring human being. Dean Strong, would you please come forward to announce the recipient of the Douglas Bocking Award?
The Douglas Bocking Award, created in honor of the former Dean of Medicine and Vice Provost, is given annually to a faculty member at the Schulich School of Medicine and Dentistry who has made an outstanding contribution to the development of medical education over the last 4 years. Past winners have demonstrated a passion for lifelong learning, a commitment to learning excellence, and motivation to build and enhance the undergraduate medical education curriculum beyond the scope of day-to-day activities. At this time, it is my privilege and great pleasure to recognize the 2014 recipient of the Douglas Bocking Award. This year's honoree has been a teacher, a mentor, and a course chair. As a teacher, this year's recipient has demonstrated excellence since 1993. As a mentor and friend, this year's recipient is a respected member of the undergraduate medical education program and a colleague and confidant to all. As a course chair, she has demonstrated a gold standard in terms of course organization, course management, leadership, and student-centered learning. With her colleagues, this year's recipient has pored over countless pages of lecture notes, textbook pages, videos, and slides to understand every aspect of the course curriculum, every objective taught by every lecturer, and every component of student assessment. This year's recipient is also unequivocally modest. Rarely a day goes by when she does not thank a member of the undergraduate medical education staff, recognize the efforts of a colleague, or promote the cause or success of a friend. In her approach to her teaching, this year's recipient uses excellent personal skills, attention to detail, and student engagement as the pillars of her approach. She relates the science she teaches to everyday examples. She engages actively in Socratic questioning, even at the large classroom. She makes learning fun, even including candy rewards in class, which infectiously increases student engagement. Her enthusiasm and cheerfulness are legendary, and her kindness is transparent. She makes sure that students can reach out to her, and she unfailingly is interested in their difficulties and challenges with the material. She incorporates many one-on-one conversations with students as a natural part of her approach. It is my pleasure to present this year's Douglas Bocking Award to a 20-year veteran of the undergraduate medical education program, a member of the Department of Pathology, co-director of the flow cytometry lab, co-chair of the blood course, hematology team path leader, teacher, colleague, mentor, and very good friend, Dr. Camelia Rizkala.
I would now like to invite Jocelyn Howard to come forward. Jocelyn was chosen as the valedictorian for the class of medicine 2014. So please come forward and deliver that valedictory address we're waiting for. Jocelyn.
Vice Chancellor Deakin, Dean Strong, Principal, President Wilderman. This is going really well. Honored faculty, loved ones of the Schulich Medical School class of 2014. It is such a great honor to be able to address all of you today and to share in this incredible milestone in the lives of our 171 classmates. For the friends and family watching today, the people who will walk the stage today are some of the most remarkable humans you will ever meet. In the future, if you need a hernia repair, or someone to deliver your child, or you just need a good fife, I implore you, look no further than the Schulich Medical School class of 2014. All right, class. Before I continue, I must say you're looking rather doctorly. Especially you, Dale Edwards. You all look ready to practice medicine in an evolving medical landscape. So I'd like to reflect today on what makes our class something special. So there are a lot of things that make our class special. For example, we like taking pictures of each other sleeping. It sounds kind of creepy when you say it out loud, but it's just something we do. We also love performing live theater, whether that be in Bug Week for education, or whether that be in Tachycardia, our med school variety show, where over 100 of us were involved this year. What makes us special goes further than the fact that we're incredibly good at socializing, and that we sometimes prioritize extracurricular activities over things like sleep, personal hygiene. I'm looking at you, Tom Jordan. What makes us special goes beyond the fact that we mutually adore our classmate, Dale Edwards. And it goes beyond our undying allegiance to and love for our tyrannical but loving class rulers, Dr. Andrew House and Dr. Faisal Rahman. So what makes us special goes beyond all that. In one of our first lectures, our esteemed mentor, Dr. George Kim, said to us, "Only you know what it's like to be a Meds 2014. Only you know, and therefore you know how to care for each other." and you need to care for each other. And I feel like we really heeded that advice. We genuinely care for each other. We support each other, we celebrate one another's successes, we pick one another up when things get tough. I would say you'd be hard-pressed to find a class where its members so enjoy being together and where being a good colleague is a top priority. I'll give you some examples. So in our third year, right before we were released onto the wards in the hospital, we had a week of prep for life in clerkship, for life in the hospital. And one of our workshops was doing an IV start and blood draw workshop. And of course we practiced this on each other. So if you want to talk about trust, imagine your classmate voluntarily sitting there while you, with a noticeable tremor, repeatedly stab them in the arm with a needle. Now, during this workshop, I happened to look over at two of my classmates, John Gregory and Steph Gottheil. Now, Steph was the patient and John was the physician. And I happened to look over at exactly the moment when John, with a terrified expression on his face, looked down at his hands that were filled with Steph's blood as it was pouring out of her arm. Something had gone wrong with the tourniquet, and there was blood everywhere, and it looked like a crime scene. And amidst the chaos and the drama of all this, how did Steph look? Calm. Very calm. Very pale. But I'm sure it was no more than class 2 shock. And instead of feeling unsettled by being accidentally phlebotomized by one of her classmates, she simply said, "That's okay, don't worry about it. We have to practice on someone." And in that moment, I realized two things. Firstly, John Gregory, vascular surgeon. He's actually going into psychiatry. And the second thing I realized is that concern for a classmate comes first, even before self-resuscitation. So my second example comes from clerkship. So clerkship is our third year. We're in the hospital, and during clerkship there were some very high times, but there were some low times as well. And I'd like to talk to you all about the idea of the clerkship power-up. So for those of you who are unfamiliar, this is something that occurs generally after you've been awake for more than 20 hours. And your stress is high, and your blood sugar is low, and you're in the bowels of the emergency department at 3 a.m., and you're trying to finish a consult, but you keep getting paged every 2 minutes because this patient has a fever, and this patient's tachycardic, and this one is seizing, and this one's delirious, and this one just left the hospital AMA, and you can't remember what AMA means. I think it's a blood vessel. And you think to yourself, you know what, I might just not make it through the night. And then just as the walls are caving in, you see one of your classmates, and they too look like absolute crap. And you lock eyes, and you smile, and you nod to one another as if to say, "I'm right there with you. I know how this feels. We're gonna make it through tonight, right?" And you do. That is a clerkship power-up. My last example comes from the last 4 months of school. So in fourth year, after spending a year and a half on the wards, we come back to the classroom for an academic tune-up. So realizing that we only had so much time left with each other, we truly made the most of our free time together. We solidified the meaningful friendships that we'd formed in our first 3 years of medical school. And we found yet more friendships in our class. What's more, we valued spending time together as a whole class, which is quite remarkable because I think there were about 171 of us. So this was on match day, at tachycardia. Thank you, Kenny, Caitlin, Rob, Zaid, choreographers, everybody. This was at Schulich Palooza, at Farm Jam, at our acute coronary life support reunion tour. We worried that every occasion might be our last together, and so we made the most of it, and we communicated to each other how much we value each other. There were a lot of feels, guys. So that's what makes our class special. We feel the love. So I'm actually quite inspired by Dr. House and Dr. Aman. I think, you know, I'm okay with talking, but it's not actually my preferred medium. If you can believe that. So what I'd really prefer to do is sing. Dr. John Howard, my ukulele, please. He's my roadie. That's the only reason he's up here. All right. So this song is dedicated to, obviously, you guys, but as well to Dr. Francis Chan, who was our dear friend, our mentor, and a diehard music lover. And before he died, he wrote us a message, and at the end of it, it said, "I will be with you in May of 2014. So Dr. Chan, thank you for attending. Attention, ladies and gentlemen, I present to you your future docs. No need for you to choose carefully. I guarantee that each one rocks. How did they get so good? It's not just the organs inside of their heads. It's because they learn from the very best. It's because of Schulich Med. When we first showed up, keen as can be, Colin was old Colin, and our O-week breakfast theme, from Med Games to Farm Jam, we bingo, bango, bongoed, had no idea what we were doing, but we never let it show. All right? So that was first year. And then came second year with such a blast. We found such friendships in our class. We learned our stuff so we could pass, and Dr. Taft said that you'll have to excuse me, I'm not at my best. With Schulich no longer new to us, Dr. Johnson posed as a uterus. Such bizarre behavior could only be found at Schulich, where our teachers help us thrive. Schulich, we had the time of our lives. It wasn't always easy, but you helped to get us through. Oh, what a time here, our time at Western U. Then came clerkship, our height of incompetence. Being a clerk can be hard on your confidence. Sleep-deprived and caffeine-fueled, failing to cope. Knowing you all felt the same gave me some hope. But we got through that without too much harm. Then came carms. Then 4 months of ice, goodbye to triphalangeal thumbs. And all of us saying, we can't believe it's done. We love you, Schulich. We're Pam, Dawn, and Becky. Make sure we're fine. Schulich, where Dr. Tithicott keeps us in line. It wasn't always easy, but you helped to get us through. Oh, what a time here, our time at Western. Schulich, where our teachers help us thrive. Schulich, we had the time of our lives. Wasn't always easy, but you helped to get us through. Oh, what a time here, our time at Western.
Thank you, Jocelyn. The talented Jocelyn Howard. You may not believe this, I was going to sing this next part. Dear audience, you may wish to pull out your cameras at this point because there is about to be a photo op. Class of 2014, I'd like to invite you, if you will, to stand and turn around, wave, maybe throw a kiss, but give a big warm round of applause for your family and friends for all their support, if you will. Thank you. Dr. Tithicott, would you please come forward at this time to reaffirm the class mission statement?
I promise I won't sing. So, the class of 2014, I'd like you to stand. At this time, recite with me the words that you created that have guided you through the last 4 years of your education, and we trust will guide you through the duration of your career. You ready? Compassion and integrity, wisdom with humility, always. Thanks. Sit down.
Thank you, Gary. In a moment, I will ask Dr. Terry Paul to come forward to lead the class in taking the Hippocratic Oath. Having taken the oath, Dean Strong will present the candidates for their degrees to the Acting Chancellor. Ladies and gentlemen, I ask that all members of the audience please remain in their seats while the class is taking the Hippocratic Oath. And furthermore, we sincerely request that no pictures be taken during this portion of the program, out of respect for the solemnity of the oath and to preserve the serenity of this moment. Ladies and gentlemen, please welcome Dr. Terry Paul.
It is a custom established in our profession more than 2,000 years ago that no one shall be admitted to its privileges who has not first expressly undertaken its obligations. Now, therefore, I call upon you, class of 2014, to take, as we have taken before you, the oath which bears the name of Hippocrates. The language in which our predecessors first pronounced it is no longer spoken. The very gods to whom they called to witness have been discarded. But we still can find no nobler words than the most ancient in which to hand down the traditions of our calling. So, class of 2014, if you could please stand. In the inside cover of your program is the oath. And will you please repeat it along with me? I do solemnly swear, by whatever I hold most sacred, that I will be loyal to the profession of medicine and just and generous to its members, that I will lead my life and practice my profession in uprightness and honor, that into whatsoever house I shall enter, it shall be for the good of the sick, to the utmost of my power, holding myself far aloof from wrong, from corruption, and from tempting of others to vice, that I will exercise my profession solely for the cure of my patients and will give no drug, perform no operation for a criminal purpose, even if solicited, far less suggested. That whatsoever I shall see or hear of the lives of others, which is not fitting to be spoken, I will keep inviolably secret. These things do I swear. And now, should I be true to this, my oath, may prosperity and good repute be ever mine. The opposite, should I prove myself forsworn. Welcome to the profession, class of 2014.
I am very honored, Madam Chancellor, to present to you the candidates who have successfully completed the Doctor of Medicine program at Western's Schulich School of Medicine and Dentistry. I ask you to admit them to the degree of Doctor of Medicine for which they have been recommended by the Senate of our university.
In accordance with the power vested in me by the Senate, you will be admitted to the degree Doctor of Medicine as it shall be announced by the public orator.
Will the candidates please be seated? I would ask that Dr. Peter Flanagan and Dr. George Kim introduce the candidates in conferring of their degrees. Dear candidates, please wait for an usher to signal your row to stand and then proceed towards the chief usher who is standing at the base of the stairs to my left, and then please ascend the stairs one candidate at a time. The orator will signal you to cross the stage, and when signaled, please proceed to center stage and kneel, if you will, before the acting chancellor to be admitted to the degree of Doctor of Medicine. The orator will then announce your name as you progress to the podium on my right, where Dr. Andrew House and Dr. Faisal Rahman will present you with your Hippocratic oath. Dr. Gary Tithicott will also distribute awards and prizes for designated recipients at that time. I would ask that you then proceed down the stairs to the corridor as directed by the usher. Now, dear family and friends, you will note that there are a number of professional photographers in our midst. So photos will be captured of your special graduate, we promise, and they'll receive their hood at the bottom of the stage and once they receive their degree. These will be available to you and instructions will be given to your graduate as to how to obtain those photographs. To assist the traffic flow of the graduates moving across the stage and getting back to their seats, we would ask that other members of the audience please stay seated during this part of the ceremony. Thank you very much. There are no degrees in absentia, and so we will proceed. Dear class of Meds 2014, please accept my own sincere personal congratulations. You have worked so hard this last 4 years and before that, and your MD degree is very well deserved. I trust that you'll care for it with pride and wear it with honor. You are now officially entitled to be addressed as doctor at the conclusion of today's ceremony. And I'll invite now Dr. Peter Flanagan to take the podium.
Waiting for the parade to begin. Please approach. No. Alim Hadatia. Elizabeth Allen. Niran Argenturo Taro. David Arnott. Arika Aurora. Stephanie Elizabeth Alexandra Austin. Natasha Ruth Aziz. Brennan Anthony Ballantyne. Laura Ellen Barall. Anurag Bala. Siddhartha Bhattacharya. Alina Julia Blazer. Daniel Bredner. Karen Elma Brito. Brigitte Bruckschweiger, sorry. Sorry, Brigitte. Thank you, Alicia. Alicia Burrell. Christopher Michael Byrne. Blair Capel. Caitlin Lauren Carew. Michael Cicchini. Vivian L. Chow. Sidian Samuel Chen. Horace Cheng. Samuel Chipin. Tamara Tracy Chu. Daniel Fernando Correjo Palma. Jonathan Cosby. Sarah Kribbe. Fulan Chue. Oops. Stephen Cunningham Dunlop.
Sorry about that.
Andrea Louise Daly. Vlad Diakonita. Eric Durant. Nice speech.
Thank you.
On you go.
Okay.
She wants to talk.
Thank you.
Dale Edwards. Okay, John. Jonathan Fairbairn. Nicholas Federman. Kimberly Fielding. Chantal Jacqueline Forrestal. Christopher Foster. Michelle Aline Fraser. Lance John Carl Freiberger. Jennifer Elaine Gerasimov. Bridget Gerson. Amara Ijaz Guman. Jadaway Gong. Stephanie Gottheil. Jonathan Michael Gregory. Suhana Gupta. Sunana. Paul Richard Hammond. Melissa Nicole Hansen. Weibo Hao. Carly Jennifer Hewson. Nice speech. Nice song. Jocelyn Vanessa Howard. Sneha Iyer. Michael Sheldon Jantz. Januvi Jagatiswaran. Struggling today. Meng Jia. Ashley Victoria Dorothy Johnson. Bethany Justine Josie. Thomas Jordan. Sean Katawapatia. Akshan Kaul. Wendy Ann Cannett. Osways S. Khan. Smriti Kosley. Zaid Coat. Rachel Marie Allen Kyle. Kenneth Lamb. Lincoln Yin Kwan Lam. Jeffrey Michael Landreville. Pensilla Lang. Weizan Lee. Terrence Leeper. Martin Leung. Jennifer Lee. Lena Lee. Grace Dorothy Liao. Cassandra Madeline May Lin. Aiden Hong Ling. Mark Lipkus. Andy Liu. Eddie Yusio Lu. Brianna Page Livingston. Sabrina Liu.
Cameron John McLean. Melissa Jean McPherson. Kevinjeet Mangar. Allison Malo. Stephen Michael Malone. Krista Margison. Colin Mascaro. Nina McCurdy. Robert McKeo.
Ready to go. Where should I do it? Thank you.
Lingwei Eric Meng. Ryan Wayne Mills. Sanjibin Mishra. Manisha Mystery. Bogdan Momsiu. Elizabeth Danielle Montgomery.
Is there a story there? There is. You don't want to hear it. Congratulations. Thank you very much. The most important paper you get at the end of the stage.
Garrett Mosey. Jillian Rebecca Mount. Jason Murray. Daniel Myron. Tanya Nadon. Abdul Naeem. Michael Narty. Casey Elizabeth Neron. Derek Ng. Troy Andrew Ng. Brian Richard Nahn. Christine Rosamond Nicholas. Sarah Elizabeth O'Connor. Bethany May Oming. Michael Allen Pace. Adam Bruno Papini. I was practicing. Richard Pavlishin. Renew Payakut. Daniel Luke Pepe.
I'm sorry. I know it's true. I'm sorry.
Caitlin Grace Perkins. Michael Pham Nguyen. Marilyn Fung. Matthew Piamonte. Kaylee Mariko Pilmer. Charushi Prasad.
Congratulations again.
No. You know who goes first?
Yes, always.
Natasha Rose Raffo. Shemer Ratner. Nisathini Ravichandran. Amy Marie Reinhardt. Paul John Ricketts. Neil Rittenhouse. Joshua Rosenblatt. Bradley Alexander Ross. Robin Laura Angela Sambrook. Andrew Schisler. Glenn Scott. Natalie Sella. Keegan Charles Selby. Lauren Lee Sham. Roman Shapiro. Rahul Asa Sharma. Supriya Singh. Hao Yon Song. Sasha Kim Song. Amy Haewon Sir. Davy Tawadros. Alexis Taylor.
Hey, a little nervous. Good nervous.
J. Edward Taylor. Myron Thana.
Yeah, perfect.
Michael John Thompson. Bianca Tomsa. Audrey Min Tum Tran. David Sulis. Shireen Elizabeth Usmani. Skylar Van Osh.
Thank you so much for doing this, Doctor.
Thank you so much. Take care. Enjoy the walk.
Caitlin Van de Kappel.
Congratulations. You're here, kid. Got it.
Jackie Van Dierden. Sarah Emily Ward. Amanda Lynn Wilhelm. Nicholas Sean Williams.
Congratulations. Small bag. Daniel Jacob Wong.
Wong. Rebecca Woodford. Mark Zhu. Marguerite Youssef. Matthew Zajac. Tun Stephen Zhang.
I grant to the Dean of the Schulich School of Medicine and Dentistry the authority to confer degrees for those candidates who are absent, but I think I heard earlier there are no absent candidates, Mr. Dean, so you will not be busy.
Thank you, Madam Chancellor, Dean Strong, Dr. Tificott, members of the school, and dear class of Meds 2014, a hearty congratulations again on your hard work to get to this point. You are now officially entitled, even encouraged, to be addressed as doctor. I would now like to ask Dr. Rocco Gervais, Registrar of the College of Physicians and Surgeons of Ontario, to address the class of 2014. Dr. Gervais.
Thank you very much, Rob. Rob, I have to say I didn't get the memo about the singing. I missed that. So I won't be singing today. It really is a pleasure, class of 2014, to be here today and address you on behalf of the college and indeed on behalf of the medical profession here in Ontario. I graduated from Western. I was on the faculty here at Western for many years, so it's always a pleasure to come back. And after I left London a few years ago, I realized that what I really missed about my time in London was my interaction with medical students. And so it really is special, and I don't miss the opportunity to come back when I have that opportunity. So first, let me take this opportunity to congratulate all of you graduates. It's been a long haul, and you deserve congratulations. But let me congratulate also family and friends who've supported you over these last 4 years. First, I just want to speak a bit about the college, especially for the benefit of families and friends who are here. In Ontario, and indeed across Canada, there exists a social contract between the citizens and their doctors. And as part of that social contract, physicians are given the responsibility, indeed a privilege in law, to regulate themselves. In fulfilling this contract, just as an individual doctor has the ethical duty to put the interests of patients before their own personal interest, the profession has a duty to govern itself in the interest of the public and put the public interest before its own interest. And it does this through the regulatory body, the College of Physicians and Surgeons. In talking to you today, I'd like to share an observation and provide a perspective. Firstly, an observation. We're blessed here in Ontario and indeed across the country with a very high-quality universal health care system. It's been my privilege and the privilege of my colleagues to be able to treat patients over many years without ever having to consider their ability to pay. But our system is experiencing some problems. The cost of health care continues to increase at a rate that's unsustainable, even more concerning in the current economic climate. Despite spending more money, patients continue to have difficulty accessing timely care in many areas. And in spite of this, other patients receive tests and occasionally treatments that are not indicated. At best, a waste of valuable resources, but even more concerning, potentially causing patients harm. We're seeing physician underemployment in some areas and shortages in others. And on top of all of this, we have an aging population who are going to begin to get sick and require care. We have a problem. I'd love to be able to sing about the problem, but I'm not going to do that. So what do we do about it? I think we need leadership. Leadership is needed to make difficult choices and to direct transformative change. Leadership is needed to preserve the fundamentals of universal health care, making best use of our resources. We have to deliver health care in new and exciting ways. Henry Kissinger said that real leadership is about taking people from where they are to where they've never been. And all of you graduates are going to be called upon to provide this leadership. I know you'll do so, but I would urge that you do so with the interest of the public first and foremost. I'd next like to provide you with a perspective in the form of device. This is a perspective I've gleaned in my time in regulation. And in providing this advice, I'd like to talk to you briefly about duty. Throughout your education, you've been taught about duty. Duty to patients, your duty to the public more generally, your duty to embrace ongoing education, your duty to your colleagues. But today I want to talk to you about your duty to yourselves and your family. I recall as an intern being told by my superiors that my generation didn't work very hard, that we really didn't get it. We were lazy. I don't know if any of you have heard that. Yeah. Two things I would suggest. One, when someone says it, ignore it. And secondly, don't you be going telling young people 20 years from now the same thing, because all of my generation, or many of my generation, are doing it. So in speaking about the unlimited demand for health care, I know that in a few weeks you're going to be called upon to help meet this demand. And you're going to find from time to time that the demand will exceed your capacity. And it's at these times I would urge you not to lose sight of your duty to yourselves and your duty to your family. If you're going to be successful in caring for your patients, you must first be successful in caring for yourself. So I would urge you, don't lose sight of this most critical of duties. Staying healthy is the key to lasting success. It's certainly both in your interest and in your patient's interest. In closing, I'm delighted, on behalf of the doctors in the province, to welcome you to the profession of medicine. Congratulations to you, to your families, and best of luck. I know you are in for a truly rewarding career. Now, I'm going to be your regulator. shortly. And so I'm going to give you an assignment right now. You've worked hard, and this is your day to celebrate. So your first assignment is going to be to have a great party tonight. So enjoy yourself, congratulations, and all the best. Thank you.
Thank you, Dr. Drace. At this time, I'd like to invite Dr. Gary Tithicott forward to present some selected award recipients for overall achievement and the Hippocratic Convocation Award.
Madam Chancellor, at this time it's my distinct pleasure to call forward the recipients of the Overall Achievement Awards to return to the stage. If the following could come to the stage when I call your name. Stephanie Gautau. Amara Guman, Renu Payekot, Jocelyn Howard, and Christine Nicholas. Just smile and have your picture taken one more time. The Alpha Kappa Gold Medal is awarded to the medical student with the highest standing in the final year of studies at Western University. Congratulations, Stephanie Gautau. The Class of 1917 prize is awarded for general proficiency in all 4 years of medical studies at Western University. Amara Guman, congratulations on your achievement. Awarded at the discretion of the Dean and Schulich School of Medicine and Dentistry, the Class of 55 prize is given to a student showing outstanding promise in the practice of clinical medicine. Congratulations, Renu Payekot. The Kingswood Scholarship is awarded to the student considered most proficient by the authorities of the university. Jocelyn Howard, congratulations on this achievement. The Medical Alumni Gold Medal is given to a student graduating in medicine with the highest standing based on all 4 years at Western University. Congratulations, Christine Nicholas, on this award. It gives me great pleasure to acknowledge your outstanding achievements, and I'm confident that each of you will continue to set high standards for yourself, your peers, and our profession as you embark on your careers as physicians. Madam Chancellor, now I'd like to ask the following recipients of the Hippocratic Council Convocation Awards to join me on the stage. Would the following please come forward when I call your names? Amara Guman, Abdul Naim, Sarah O'Connor, Elizabeth Montgomery, Colin Mascaro, and Subraya Singh. Have your picture taken. The class of Meds 2009 lost a classmate to a car accident, and to honor her memory, they created the Dinah Memorial Award. Sarah O'Connor is the recipient of this year's award, selected to the graduating medical student whose vibrant, energetic, and cheerful nature contributed to the spirit of the graduating class throughout her time in studies in medical school at Western University. Congratulations, Sarah. In addition to having maintained a good academic standard, the recipient of the Meds Merrymakers of 47 Award must exhibit the qualities of leadership and innovation in extracurricular activities that have contributed to the growth of fellowship, pride, and loyalty amongst peers and faculty at Western University. Elizabeth Montgomery, congratulations on achieving this award. Congratulations. The Dr. Jim Silcox Award is given to medical students who, in the opinion of the Hippocratic Council and the Student Affairs Committee, have contributed most significantly to the lives of students, faculty, and to the community. Congratulations to recipients of this year's award, Colin Mascaro and Supriya Singh. Finally, we come to the Francis Chan Distinction Award, which is given to a member of the graduating class who demonstrates enthusiasm and dedication to advocating for the rights of others within the school and or the external community, balancing in life with a passion for extracurricular activities and involvement in the school and external community. This year, Amira Guman and Abdul Naeem will share this award. Congratulations to both of you. Again, I'd like to join everyone here and say it's my pleasure and honor to recognize all your achievements and especially the award winners' efforts in the course of your time in undergraduate studies, and I wish you all the best, and especially to the award winners of the class of 2014. Congratulations.
Congratulations, awardees, and thank you, Dr. Tithicott. You may know the student convocation coordinators as Grace, Bethany, and Bianca, but there's been a change. As they come forward, I would now like to ask you to welcome Dr. Grace Liao, Dr. Bethany Oming, and Dr. Bianca Tomsa, please.
On behalf of the Convocation Committee, myself, Bianca, and Grace would like to thank everyone for joining us today. We would also like to take a moment to extend our deepest thanks to Pamela Beer, Dr. Marjorie Johnson, and Dr. Robert Hammond for all their hard work in making today's ceremony possible. Thank you. And if the three of them could join us, we have a small token of our appreciation. So everyone must be pretty hungry. So we do have a luncheon being served in the Great Hall from 12 until 2 p.m. So we would welcome you all to join us there. And just to remind the graduates, we'll be taking a group photo on the UC Hill, the same place we took it in first year, right after the ceremony and before the luncheon. So we hope to see you all there, and thank you once again for coming.
Thank you, doctors. Finally, please join me again in adding thanks to the Da Capo Strings Quartet for today's music. And again, my own personal thanks to the small army of dedicated staff led by Pam Beer, who take care of every detail of this morning for you to make this convocation the wonderful event that it is. Before we finish, I would like to let you know a few important pieces of information. Immediately following the ceremony, there will be a group class photo on University College Hill. And we've confirmed with weather reports that an outdoor photograph is going to be possible today. Grads, if you can move to the University Hill immediately after the ceremony is over, the photographer will take the photo quickly and leave you still with plenty of time for your own personal photos with family and friends. And a digital copy of that group photo will be shared with the class. It's also important for you to know that there's a reception for our new alumni, their parents, family, and friends immediately after the ceremony, and it's being held in the Great Hall in Somerville House, which is not far outside the front doors of Alumni Hall. Please note that the campus police will briefly close the road in front of Alumni Hall to traffic, and that's to ensure the safe exit of the graduates and their guests. What this means is that if you are parked in the Alumni Hall parking lot, there will be a short delay if you're planning to leave campus, so please understand this is being done in the measure of safety. When I've concluded, the Esquire Bedell will come forward to the front of the mace table. And at that moment, I would ask that everyone please rise to sing God Save the Queen. The acting chancellor will then close the convocation ceremony. The Esquire Bedell will lift the mace from the table, signaling the recession of the platform party and our graduates. Following dismissal of convocation, the honored platform guests will leave the stage and proceed out of the auditorium. And the remainder of the faculty will follow the honored platform guests. I would ask that our graduates then file out of the auditorium immediately after the faculty. I would ask all of you to please remain standing while the platform guests and graduates exit the auditorium. Finally, again, dear class of 2014, from the bottom of our collective hearts, we wish every one of you the very best that life and this career has to offer. Congratulations again.
Before adjourning convocation, I would also like to add my thanks to the many hundreds of people who make a day like this possible. It doesn't come off this well by accident. So I'd again like to congratulate the class of 2014 of the Schulich School of Dentistry and Medicine. And on that note, convocation is adjourned.